Hello, welcome to William's English Lessons. 大家好，在今天的视频中，我将介绍人体的肺部、肺部疾病和症状。肺部是对寒冷最敏感的器官。因为冬天即将来临，我希望这个视频不仅能帮助学习英语，还能帮助学习健康知识。希望这个冬天大家都健康平安。让我们开始今天的学习吧。Part 1. The 6 most common lung diseases. Pneumonia. In the picture, the circle on top is for a healthy lung, and the circle on the bottom is for a diseased lung. Pneumonia is mainly caused by infections by pathogenic microorganisms such as bacteria, viruses, fungi, and parasites. Physical and chemical factors such as radiation and inhaled foreign bodies can also cause pneumonia. Asthma. In the picture, the airway on the left is for a healthy lung, and the airway on the right is for a diseased lung. Many asthmas are related to genetics, and some are caused by multiple allergens. Indoor mites, animal hair and sebum secretions, fungi, outdoor pollen, grass and tree powder, etc., can cause asthma. Tuberculosis. The picture shows human-to-human transmission from a diseased person on the left to a healthy person on the right. Tuberculosis is caused by infection with Mycobacterium tuberculosis. Tuberculosis is a highly infectious disease, and Mycobacterium tuberculosis can be spread through saliva. Bronchitis. In the picture, the circle on the top is for a healthy lung, and the circle on the bottom is for a diseased lung. Bronchitis is a chronic inflammation of the trachea, bronchial mucosa, and surrounding tissues. Viruses and bacteria invade the bronchus, causing chronic inflammation caused by repeated infections. Falling temperatures can weaken the defense function of the respiratory tract, making it easier to get sick. Allergies, smoke, dust, air pollution, and smoking can also cause the disease. Emphysema. In the picture, the circle on the left is for a healthy lung with normal bronchial and alveoli. In the circle on the right is a diseased lung with alveoli affected by emphysema. Lung infection, air pollution, smoking, etc. can cause inflammation of the bronchioles, narrowing or blocking the lumen, leading to emphysema. Chronic obstructive pulmonary disease, COPD. In the picture, the box on the top is for a healthy lung, and the box on the bottom is for a diseased lung. In the bottom box, the alveoli is filled with mucus. Chronic obstructive pulmonary disease, COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, sputum production, and wheezing. Emphysema and chronic bronchitis are the two most common conditions that can contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. Part 2. Common symptoms related to lung disease. Cough. Cough. Chronic cough. Chronic cough. Wheezing. Wheezing. Mucus or sputum. Mucus or sputum. Trouble breathing. Trouble breathing. Shortness of breath. Shortness of breath. Coughing up blood. Coughing up blood. Chronic chest pain. Chronic chest pain. A cough that won't go away. A cough that won't go away. Coughing up blood or mucus. Coughing up blood or mucus. Feeling like you're not getting enough air. Feeling like you're not getting enough air. Pain or discomfort when breathing in or out. Pain or discomfort when breathing in or out. Part 3. Briefly introduce the structure and function of the lungs. In the picture, there are two parts of the lungs, the right lung and the left lung. They are joined by branches called bronchuses to a central part called the trachea, which is the throat, and leads to the nose. The human lungs are divided into left and right parts. Occupying most of the volume of the left and right chest, respectively. The human lungs are divided into left and right parts, occupying most of the volume of the left and right chest, respectively. From an anatomical point of view, the right lung can be divided into 3 lobes: upper, middle, and lower lobes, while the left lung has only 2 lobes, upper and lower. From an anatomical point of view, the right lung can be divided into 3 lobes: upper, middle, and lower lobes, while the left lung has only 2 lobes, upper and lower. Each lobe of the lung has an independent bronchus and blood supply, artery and veins, and its structure and function are relatively independent. Each lobe of the lung has an independent bronchus and blood supply, arteries and veins, and its structure and function are relatively independent. In terms of fibrous structure, the lungs are mainly composed of sponge-like tissue with a very large inner surface, which is where gas exchange occurs. In terms of fibrous structure, the lungs are mainly composed of sponge-like tissue with a very large inner surface, which is where gas exchange occurs. Thank you for watching. I hope you enjoyed this video.